Hello, I'm Joseph Alpert, editor-in-chief of the American Journal of Medicine, and I'm here to call your attention to another very interesting article with clinical relevance in this month's journal. It comes from the First Responder Safety Lab at Skidmore College in upstate New York, in which they did a very interesting study using about 1,000 firemen. They put them through exercise tests and looked to see abnormal responses. And it turned out that the abnormal responses were no surprise in individuals who weren't fit. They weren't doing the right thing. They were overweight and or possibly even had metabolic syndrome or diabetes and so forth. Now, why is this important? It turns out that there's an increased incidence of myocardial infarction, heart attack in firemen. They get exposed to terrible fumes and huge surges of the sympathetic nervous system, running, and using lots of energy and, at the time of fire. And I know when I was in Massachusetts, they have a police and fire law. Any police or fireman who develops cardiovascular or pulmonary disease while on service is automatically retired at full pay. And so, and I think many other states have the same thing. Well, this tells you we can identify some of the people who are at higher risk for these events. And what they suggest is, of course, these folks should get into a program, to reduce their risk factors so that they would have less of a chance of having a heart attack, a myocardial infarction at the time of a fire when they're incredibly stressed. So again, clinically relevant. This was based on 1,000 firefighters, so it's a good database. So I hope you'll read it and think about it the next time you see a fireman in the office. Thanks for staying in touch with us through our social media, and talk with you next month.